A new chapter for healthcare across the region is now underway after an historic proposal to merge the region's two largest health systems. Final approval today from the state of Tennessee, making that merger official. Good evening, I'm Josh Smith.
And I'm Sarah Diamond. Today marked the deadline for the state of Tennessee to grant approval of the deal. This comes 3 years after Mountain States Health Alliance and Wellmont Health System announced their proposal to form a new company called Ballad Health. Justin Soto joins us live outside Johnson City Medical Center, where some changes have already taken place.
Well, a spokesperson from Mountain States Health Alliance tells us tonight that they're grateful for the hard work from both states in this process, and they're excited about what's to come with Ballad Health. And I want you to take a closer look at the statement we got from the Tennessee Department of Health just this afternoon. Commissioner John Dreisner announced the state is officially allowing Wellmont Health System and Mountain States Health Alliance to merge as one via the COPA agreement. The logos are already changing on Twitter for both Mountain States Health Alliance and Wellmont. As you can see, they're black. This deal is set to employ more than 15,000 people across Northeast Tennessee and Southwest Virginia. And with a new hospital system comes leadership changes for Mountain States Health Alliance as well. We're learning that Stan Hickson has been named CEO of the Washington County, Tennessee operations, and John Jeter has been appointed CEO of Johnston Memorial Hospital, that's in Abingdon, Virginia. These changes come after Melody Trimble, who served as CEO of Washington County, Tennessee operations since 2014, left, and she'll spend her last day on the job February 9th. And we're expecting more information from both Wellmont Health System and Mountain States Health Alliance coming up on Friday in a news conference in Kingsport. But for now, we're live in Johnson City. I'm Justin Soto, News Channel 11, in your corner.
Justin, thanks. A finalization of the merger comes after, like we said, about 3 years of history-making events. Absolutely.
Some of it played out in public. A lot of it played out behind closed doors and board meetings and in negotiation sessions. It all began, though, in an unlikely alliance. The announcement in April 2015 represented what once seemed impossible. Two rivals that waged a turf war in a fight for dominance, coming to terms with reality that the old business model of running hospitals no longer worked, coming to believe that instead of fighting each other, they could be better together.
The end goal is really to improve and make everyone's lives better in the region.
But first, they had to overcome a big problem. By merging, they'd create a monopoly, something the Federal Trade Commission has made it clear it does not like. So under the leadership of deal architect and Mountain States Health Alliance boss Alan Levine, the health systems quietly pushed for a change in state laws, creating a process by which they could win state approval and shield themselves from federal antitrust action.
Look, we're not perfect. We're going to make mistakes along the way, but I think what I hope people understand is our intentions are 100% to do the right thing for this region, first and foremost, and for the patients that we serve.
That did not stop the Federal Trade Commission staff members from repeatedly and publicly criticizing the merger, saying it would harm people who depend on the companies for health care. Outside analysts offered criticisms as well, and even some local voices said no. But the vast majority of local voices said yes, and eventually so did the states of Tennessee and Virginia in late 2017. In getting approval, though, even the masterminds of the deal admitted they had to give up far more control to the states than they ever initially intended.
There's opportunities for us in the state to learn what we can learn and to adjust as we go if we need to.
Again, we'll learn more Friday morning. What exists now is really a brand new entity, something unlike any other in Tennessee and in Virginia, a private not-for-profit company that is deeply tied to two state governments with conditions that have to be met, with rules that now have to be followed.